5 minutes to master the public health ladder. From stopping risk factors before they're born to avoiding overtreatment. Chalo, start. This is a favorite suck viva. It structures any answer on NCDs, infections, screening, rehab, and health policy. If you know the levels, you can build a crisp plan for any disease. Levels of prevention are stages at which we intervene across the natural history of disease, from society and behaviors to early disease, complications, and over-medicalization. The classic 4 are primordial, primary, secondary, tertiary. Modern texts add quaternary. Primordial prevention acts on social, economic, and environmental determinants before individuals acquire risky behaviors or exposures. Tools include policies, regulations, urban design, taxation, food systems, and school-based interventions. In India, examples include tobacco control laws, higher taxes, and bans on advertising to reduce initiation. Other examples are salt and trans fat limits in packaged foods, front-of-pack labeling, safe roads, walkable cities, school pay periods, and midday meal quality. Clean fuels like LPG, PNG also reduce biomass smoke exposure. Primary prevention focuses on preventing disease occurrence with two components: health promotion and specific protection. Health promotion involves education, diet quality, physical activity, mental health, safe sex, reducing alcohol, sleep hygiene, and community mobilization. Specific protection includes targeted measures against specific diseases or exposures. This includes immunization for diseases like DPT, measles, HPV, and HBV. Chemoprophylaxis, such as iron thiofolate in pregnancy or cotrimoxazole in PLEV, is also crucial. Barrier and PPE, like condoms, helmets, masks, and occupational safety gear, provide direct protection. Environmental controls, including fluoridation or defluoridation and vector control, are also key. Secondary prevention focuses on early detection and prompt treatment to improve outcomes. The purpose is to find disease in an early, asymptomatic or early symptomatic stage. This is achieved through screening, confirmatory diagnosis, and timely treatment. Programmatic examples in primary care in India include population-based screening for oral, breast, and cervical cancers at health and wellness centers. Hypertension and diabetes detection at community and OPD levels are also important. For TB, systematic screening of presumptives and rapid molecular tests are part of the NTAP. Good screening tests are for important health problems, acceptable, reasonably accurate, and have facilities for diagnosis and treatment. Tertiary prevention aims to limit disability and restore function. Its two sub-goals are disability limitation and rehabilitation. Disability limitation involves early effective treatment to prevent complications like tight glycemic and BP control to prevent nephropathy or retinopathy. Rehabilitation includes medical, psychological, social, and vocational aspects. Palliative care also sits here, providing pain relief, symptom control, caregiver support, and end-of-life dignity. Quaternary prevention focuses on avoiding harm from unnecessary care. The idea is to identify people at risk of over-medicalization and protect them from interventions where harms exceed benefits. Examples include avoiding antibiotics for viral urti, limiting imaging without red flags, and deprescribing in polypharmacy. Enablers are shared decision-making, clinical guidelines, periodic medication review, and audit and feedback. To use this in exams and clinics, start with the disease and walk through the levels in order. For coronary artery disease, primordial prevention involves city policies for active transport and trans fat regulation. Primary prevention includes lifestyle counseling, statins for high-risk individuals, and tobacco cessation.
Secondary prevention involves opportunistic BP diabetes checks, risk scoring, and treadmill ECG when indicated.
Tertiary prevention covers ACS protocols, cardiac rehab, long-term antiplatelets, and BPA1C LDL targets. Quaternary prevention means avoiding duplicate tests, rational imaging, and deprescribing when stable.
If the examiner asks for levels for cervical cancer control, primordial prevention includes girls' education, delaying early marriage, and gender equity.
Primary prevention involves HPV vaccination and safe sex practices. Secondary prevention is via at PHC with screen and treat. Tertiary prevention includes oncology care, pain relief, and rehabilitation. Quaternary prevention means avoiding unnecessary repeat procedures without indication. Primordial prevents risk factors. Primary prevents disease. Secondary detects early disease. Tertiary reduces disability and restores function. Quaternary prevents overuse or harm. Always cite one concrete example per level for the disease in question. For screening, mention the target group, test, interval, confirmatory step, and linkage to treatment. For tertiary, remember both rehabilitation and palliative care, often missed in answers. Think in layers, shape environments, build healthy behaviors and protections, catch disease early, limit damage and restore life, and don't overtreat. Apply the ladder to any condition and your plan writes itself. Public health is strongest when prevention starts before disease and continues after diagnosis. Design wisely, treat promptly, and protect patients from harm. That's complete care. If you found this episode helpful, don't forget to like, share, and subscribe to the channel for more high-yield made school content.